Imagine, just for a moment, that the thing you have laughed about your entire adult life, the running joke at every dinner table, the reason your partner flinches when you slide your hands under the covers, the reason you keep a cardigan draped over the back of every chair in your house, was never a quirk of your personality at all. Imagine that it was, in fact, your body sending you the exact same warning signal over and over for 10, 15, 20 years in a language nobody ever taught you to read. Does that sound dramatic? I wish it were. I am Dr. Evan Jace, and I have spent more years than I want to count looking down at lab panels in clinic rooms, then looking up at the patient sitting across from me, and watching the moment their face changes when I tell them that the answer to the question they have been asking their entire adult life was sitting in a blood test that nobody bothered to order. Hold your hands up in front of you right now. Go on, do it. Look at your fingertips. Look at the color of the skin under your nails. Press the pad of one finger against the inside of your forearm and feel the difference in temperature. If your fingertips are paler than the rest of your hand, if the skin against your forearm feels noticeably colder, if you have spent years pulling your sleeves down over your knuckles in rooms where everyone else is perfectly comfortable, then your body has been trying to tell you something very specific for a very long time. And the thing it has been trying to tell you has a name: Vitamin B12. I want to be careful here because I know how this sounds. A YouTube video, a doctor on the internet, telling you that one vitamin explains the thing you have lived with your entire life. So let me anchor you in the data before we go any further. The World Health Organization and the National Institutes of Health have both published prevalence estimates suggesting that up to 1 in 3 adults globally are walking around right now with a measurable B12 deficiency, and the number climbs sharply past the age of 60. The British Journal of Hematology has been publishing warnings for over a decade that this deficiency is being missed at extraordinary rates because the symptoms arrive so slowly, so quietly, and so disguised as ordinary aging that neither the patient nor the physician thinks to test for it until the damage has already begun. And here is the part that keeps me up at night. B12 deficiency does not arrive as a crisis. It arrives as a slow erosion.
It takes your hands first. It takes your nerves second. It takes your brain last. And in some tissues, by the time you notice the damage clearly enough to ask about it, the damage has already become irreversible. I'm going to walk you through 5 signs your body has been showing you, possibly for years, that point to this single deficiency. 5 signs that almost certainly include at least one you are experiencing right now, sitting in the chair where you are watching this. 5 signs that no general practitioner ever connected for you, because nobody is paid to sit you down and explain the pattern. I am going to explain the pattern. Stay with me to the end, because the 5th sign is the one I am most afraid of, and it is the one I have watched destroy the most lives.
Let us begin with the cold hands. It is 7 in the morning, and you wrap your palms around a mug of coffee. 10 minutes later, the mug is still hot, and your fingertips are still cold against the ceramic. You are in a meeting at work, and you tuck your hands under your thighs to warm them, while the person across from you presents a slide deck in shirt sleeves. You climb into bed at night, and your partner says the same sentence they have said for 20 years. Your hands are like ice. Here is what is actually happening underneath that moment. Every red blood cell in your body is a delivery truck, and its only job is to carry oxygen from your lungs out to the farthest neighborhoods of your circulation. The fingertips and the toes are the farthest neighborhoods. They sit at the end of the longest delivery route.
Curious. To build a fleet of those delivery trucks that are small, flexible, and packed with hemoglobin, your bone marrow needs B12 as a non-negotiable ingredient. Without enough B12, the marrow still tries to produce red blood cells, but it produces fewer of them, and the ones it does produce come out oversized, sluggish, and half-empty. The trucks still leave the depot. They still drive the route. But by the time they reach the last houses on the street, there is barely any oxygen left to drop off. Your fingertips are those last houses. They are getting starved first, every single day. And they have been getting starved every single day for as long as you have been making jokes about needing fingerless gloves indoors. Chronic peripheral hypoxia is not a benign state. Over years, it damages the tiny capillaries themselves, and the small vessel injury that follows is one of the harder kinds to undo.
So I want you to do something for me right now. In the comments below, tell me honestly how many pairs of socks you are wearing at this exact moment. Be honest, not aspirational. That number is a piece of data, and here is the practical fix. When you walk into your doctor's office, do not accept a routine vitamin panel. Ask by name for a serum B12, methylmalonic acid, and homocysteine. 3 tests. Methylmalonic acid is the metabolic fingerprint that confirms what serum B12 alone can miss. Burn those 3 words into your memory. Now I want you to walk to a bathroom mirror. I am serious. Pause this video if you have to. Walk to a mirror, open your mouth, and stick out your tongue. What does the surface look like? A healthy tongue is textured. The surface is covered in thousands of tiny papillae, the little raised bumps that give it that rough, almost velvety quality when you run it across the roof of your mouth. Now look at yours. Is the surface unusually smooth? Glossy? Almost shiny? A redder, beefier color than you remember it being a few years ago? That sign has a name in clinical medicine. It is called atrophic glossitis, and it is one of the most specific physical findings in the entire diagnostic vocabulary of B12 deficiency. The cells lining the surface of the tongue are some of the fastest dividing cells in the entire human body. They turn over constantly, and to turn over they need B12.
Without it, the surface cannot regenerate, and the papillae are sanded smooth like a carpet that has been walked over for 50 years until the texture is gone and only the backing remains. And the cruelest part is that the same thing is happening on every other rapidly dividing epithelial surface in your body that you cannot see. The lining of your gut, the cells of your mouth, the reason you have been getting recurrent ulcers, the reason food has tasted slightly off for the last year and you assumed it was age, the reason your mouth burns sometimes when you eat citrus. Photograph your tongue right now. Use the camera on the phone you are probably holding. Save the image. The next time you sit in front of a physician, show it to them and ask directly whether this could be glossitis from B12 deficiency. If they brush you off, find another physician. This is not a vague complaint. It is a visible sign. Now, the third sign, and this is the one you have been ignoring the longest because it is the easiest to explain away. The tingling. You are sitting at your desk and you notice a faint pins and needles sensation in your fingertips. You lie in bed, and the soles of your feet feel like they are humming. You have been telling yourself for years that you slept on your arm wrong, that your shoes were too tight, that you crossed your legs for too long. Sometimes that is what it is. And sometimes it is the beginning of peripheral neuropathy. Every nerve in your body, from the ones in the soles of your feet to the ones running up your spinal cord, is wrapped in a fatty insulating sheath called myelin. Myelin is what lets nerve signals travel cleanly from one end of the wire to the other. And the maintenance of that myelin sheath, the constant repair of it as your body rebuilds itself day after day, requires B12. Without enough B12, the insulation begins to thin. Microscopic gaps appear. The signals start to leak, sparks start to misfire, and the brain receives garbled messages from the nerves at the ends of your limbs. That is the tingling. That is the buzzing in your feet at night. That is the patch of numbness you noticed on the back of your hand last month and decided was nothing. Here is what I need you to understand, and I am going to say it slowly. Peripheral neuropathy from prolonged B12 deficiency, if it is left long enough, becomes permanent. The nerves do not always grow their insulation back. The progression is well documented. It begins as tingling. It moves to numbness. It moves to loss of position sense, the inability to know where your feet are without looking at them. It moves to balance problems. It moves to falls.
I have watched patients reach the end of that progression because nobody ordered a blood test 15 years earlier. When was the last time you felt that tingle? Comment the moment. Last night? This morning? Right now as you are watching this? That answer matters. This is a clinical emergency in slow motion, and you do not wait for the next symptom to act on it. Sign 4. The exhaustion that nobody has solved for you. It is 3 in the afternoon, you have slept 8 hours, you have already had 2 coffees, and you are fighting to keep your eyes open at your desk. You have been told it is your age, your stress, your hormones, your screens, your sleep hygiene. You have tried magnesium, ashwagandha, melatonin, a standing desk, a sunrise lamp, a cold shower routine, and nothing has touched it. I want you to consider seriously that the reason none of those things have worked is that none of them are aimed at the actual mechanism. The mechanism is this. The same fleet of half-empty delivery trucks that is failing to deliver oxygen to your fingertips is also failing to deliver oxygen to every muscle, every organ, every neuron, all day, every day. The condition has a name: megaloblastic anemia.
Large cells, fewer of them, less oxygen carrying capacity, less life in every tissue. And the cruel thing about it is that it does not feel like the dramatic collapse on the couch that you would associate with anemia in a movie. It feels like a quiet, grinding, low-grade fatigue that has been so consistent for so long that you have forgotten what real energy feels like. You have redefined normal downward year by year without ever noticing the line moving.
Ask yourself, honestly, when was the last time you woke up feeling genuinely rested? Not okay, not functional. Genuinely rested. If you cannot remember the answer, that itself is a piece of data. The practical fix here is to insist on a complete blood count alongside the B12 panel, and to ask, by name, about your mean corpuscular volume. That is a single number on the lab report, abbreviated MCV, and it tells you the average size of your red blood cells. When MCV climbs above the normal range, that is the marker that should make any competent physician immediately suspect B12 or folate deficiency. It is the cheapest, oldest, most reliable flag in the entire diagnostic toolkit, and it gets missed every day. And now we arrive at the fifth sign, the one I am the most afraid of, the one that has been hiding in plain sight under the most innocent, most forgivable, most universally accepted name: the brain fog.
You walked into a room last week and forgot why you were there. A name was on the tip of your tongue and would not come. You started a sentence and trailed off in the middle of it, and your spouse finished it for you without looking up. You laughed about it. You called it a senior moment. You called it perimenopause. You called it stress. You said your brain is just full these days. I am going to tell you what is actually happening, and I am telling you this because it is reversible if you catch it early, and irreversible if you do not. B12 deficiency attacks your brain in 2 distinct ways at the same time, and you have been living under both attacks simultaneously. Attack 1 is the same oxygen starvation that is freezing your fingertips and grinding your energy down to nothing. Your brain is the most oxygen-hungry organ in your body. It consumes roughly 20% of your total oxygen supply. When the delivery trucks are half empty, the cognitive cost is immediate and constant. Attack 2 is the same demyelination process that is causing the tingling in your hands and feet, except now it is happening inside your central nervous system. The myelin sheaths in your spinal cord and your brain are thinning. The signals between neurons are misfiring, and the integration of thought, memory, and language that you have always taken for granted is quietly degrading. 2 attacks, every day, for years, slowly reshaping what you think of as your own mind. And here is where it gets worse, because the risk is not evenly distributed. If you are vegan or vegetarian, you are getting almost no dietary B12. If you are taking metformin for diabetes, the drug actively impairs B12 absorption. If you are on long-term proton pump inhibitors, the omeprazoles and pantoprazoles people take for reflux, you are blocking the stomach acid you need to liberate B12 from food. If you are over the age of 60, your production of intrinsic factor, the protein that ferries B12 across your intestinal lining, has likely declined. Stack any 2 of those, and your risk is not theoretical. It is structural. So I want you to comment honestly which of those 4 categories you fall into. Vegetarian, metformin, PPI, over 60. Comment the letter that applies to you. That comment is for you as much as it is for me, because writing it down is the moment you stop treating this as somebody else's problem. The fix here is the same as for every other sign: serum B12, methylmalonic acid, homocysteine, complete blood count with MCV, and if the deficiency is confirmed, the treatment depends on the cause, but it most often involves either high-dose oral cyanocobalamin or methylcobalamin, and in cases of absorption failure, intramuscular injections. None of this is exotic. None of it is expensive. All of it is sitting on the other side of a conversation that you have not yet had. Now I want to give you the part you came here for, which is the reframe. Because if I leave you in the dread without leaving you in the hope, I have failed you as a physician. The body responds. Within weeks of correcting a B12 deficiency, hemoglobin begins to rebuild. The fleet of delivery trucks starts running fuller routes. The fingertips warm. The fatigue begins to lift. The tongue regenerates its surface, papillae returning week by week. The tingling, if caught before the nerves are permanently injured, recedes. The cognitive fog, if caught before the demyelination has gone too far, lifts in ways that patients have described to me, sitting in my office months later, as feeling like a window was opened in a room that had been closed for a decade. The body wants to repair itself. It has been waiting for the ingredient. So let me give you the checklist one more time, the way a colleague might read it aloud from the doorway of the exam room as you are putting your coat back on. Sign 1. Cold hands and feet that nobody has explained. Sign 2. A smooth, glossy, beefy red tongue that has lost its texture. Sign 3. Tingling, pins and needles, or patches of numbness in your extremities. Sign 4. A grinding daily exhaustion that no amount of sleep has fixed. Sign 5. The forgetfulness, the lost words, the brain fog you have been calling age. 1 deficiency. 5 languages. Sitting on the other side of a single blood draw. Your body has been showing you this signal for years, in 5 different rooms of the same house, and nobody taught you to read any of the signs. I am asking you, please, to start listening. Walk into a doctor's office this week. Use the 3 words: serum B12, methylmalonic acid, homocysteine. Insist on the MCV. Photograph your tongue. Bring this video if you have to. And then, before you close this app, before you let this slide back into the noise of the rest of your day, I want you to do one more thing for me. Think of the person in your life who has cold hands. The mother whose fingers were always icy when she tucked you in. The sister who wears 2 sweaters in summer. The partner whose feet you have warmed with your own for years, without ever asking why they were cold to begin with. Send them this video, right now, not later, now. Because the thing I have learned from too many lab panels and too many late conversations is that the people who need this information the most are almost never the ones who go looking for it. They are the ones who get sent it by someone who loves them. Be that someone today. I am Dr. Evan Jace. Thank you for sitting with me. I will see you in the next one.